Hey y'all, and welcome back to my channel. On this page, I talk about technology, money, hockey, and sometimes trending news. If you're new here, welcome. I'm glad the algorithm or a friend brought you here. And if you're returning, welcome back. Today, I want to talk about a story that's been around for a couple of days. And I saw it when I first saw it, then I saw it being picked up on nurse social media. But it's about how a very large health system out in Oregon has cut nursing frontline nursing positions, specifically telehealth nursing positions. And this is really interesting because even once COVID hit and many different organizations and businesses and healthcare began cutting back in positions, frontline nurses, registered nurses, because there's always a nursing shortage going on, nursing positions have always been considered as protected from job cuts. So I found this story. Well, it's not just a story; it really impacted people's lives. I found it really interesting because as we continue to see the impact, even though COVID has, it's not like it was in 2020, 2021. The world somewhat returned to what it was before it, but as we're seeing many different businesses and different types of operations, even beyond healthcare, continue to shift how they do business. This is the first time I've seen patient facing type positions for nurses be cut. And it's interesting because folks are wondering, is this becoming an emerging trend for healthcare where registered nurse, frontline, patient facing positions are no longer considered to be always safe and golden? Now, an interesting perspective on it. I read this article, but I saw another outlet also linked to the organizations. It looked like an annual report that they shared during the meeting where they talked about eliminating these positions. But let's very quickly get into the article. It's very short. As always, I'll be sure to leave a link to all references and anything I share in the description box after the live. I always encourage people to go to the references I post or any other person you come across on social media. Always be sure to do your own research beyond just what a person shares. So the article goes, and this is out in Oregon. Fires a group of telehealth nurses at Lauded during the pandemic. So, as part of wide-ranging job cuts, Oregon Health and Science University this week cut a telehealth nursing unit set up during the pandemic that was featured in the organization's foundation website for service to people throughout the state. Now, Oregon Health and Science University is the largest provider of healthcare in the state. So this is not a small organization doing these cuts. Okay. So back in March of 2020, they started the Connected Care Center. It was open only to Oregon Health and Science University patients, and then they expanded out and opened it to the public afterward. This was a position in which registered nurses work from home. They took calls about testing locations, questions about quarantining, and caring for COVID. So I did find a link to the news article and also a one-sheeter about this connected care line. So it talked about when the unit first opened, how effective it was. They shared some data about the number of calls that they had received, like within the first, I want to say the first quarter or so the first 3 or 4 months. That hotline, this connected care center for these telehealth nurses, had taken over 8,000 calls. They got feedback from the public. It was very well received. Okay. And then they had 16 nurses who worked within the connected care center. They also, were triaging patient calls, etc., and also supporting the clinics. So this organization has recently undergone what is called a rift or reduction in force. So they cut 500 positions, which included this nursing unit. But it's really interesting because when you see healthcare, hospitals, et cetera, typically cut positions, they're more so in administrative, back end office type role. So that's again another reason why these job cuts for registered nurse positions really caught my eye. So they said cutting nurses is confirmation. Now this is from the Oregon Nurses Association. Okay. Oregon Nurses Association, their vice president says, it's just confirmation that the organization leaders were not limiting their layoffs to non-patient facing positions, talking about how it would impact patient care for the public across the state. So there were 16 nurses in this telehealth nursing department, but there was a total of 22 nursing positions that were cut. But I also saw that this organization also sounds like they're undergoing an M&A or a merger and acquisition or a merger with another health system that are dealing with issues around costs for salaries and supplies. And they talked a little bit about the strategy. But something really interesting that I found or that I read in the or I listened to in the video from the annual report where they shared the numbers. So this organization, now they cut positions, but they also shared in this report that there was an average increase in wages up almost 6%. They said 5.9%. They also increased health benefits by 8%. But what I found interesting and I think may have contributed, again, I don't know this organization's finances, etc. I did a few years in hospital operations, but I found this pieces of data that I'm about to share. I wonder if it's related to why they had to do a reduction in force. Number one, the inpatient admissions were down by 18%. So for those who don't work in healthcare or hospitals or hospital operations, inpatient admissions, also services like surgeries or service lines like heart care, cancer care, etc., tend to bring in a lot of revenue. Okay, so inpatient admissions have a tendency to bring in a lot of revenue. That was down 18%. The number of transfers from outside hospitals was down 47%, which is almost 50%. That's a lot of revenue loss. That means there were almost half of the patients from different health systems coming into this organization had almost been cut in half. Their ED admissions were up 28%, but ED admissions would be considered like an ambulatory or outpatient type service by a health system. It would not bring in as much revenue as the inpatient admission, which again was down. Their skilled nursing facility admissions were down 21%, and then said their adult admissions were down 8%. So this tells me, just very high level, looking at the numbers that they shared in this report, that this organization's they were not bringing in as much revenue, but then of course they're still having to contend with things like supplies, etc., and of course salaries. And regardless of the admissions and revenue that you're bringing in, you still have your operating expenses. You still have to keep the lights on. Okay, so number one, I think when nurses see that registered nurse patient-facing positions are being cut, I'm not saying it's a trend, but I do think there is definite, it's a for sure sign in changes in opportunities for nurses in patient-facing positions where they're not necessarily safe anymore. Because it's always been considered, oh, I'm a registered nurse at the bedside or in a patient-facing position, my position is safe. I think this is a sign, not to say that it's a trend, but I do think it's a sign that there are some changes in how those opportunities are presented for nurses. I do believe that opportunities for registered nurses in bedside positions are not going anywhere at all. So overall, I don't think nurses have to be concerned about these cuts, but I do think they have to start thinking differently, which is why I talk a lot on this channel about how technology is changing healthcare and how nurses, no matter where you practice, at the bedside, ambulatory, peri-op, I work in tech, no matter where you practice, you always have to be upskilling and preparing yourself, because these changes like this, sometimes they can come out of left field and sometimes with no warning. We always have to be ready, have a ram in the bush. and keep ensuring that our skills are up to date and that we're constantly educating ourselves. But here's the reason why overall, I don't think nurses have to be worried. And the reason why I say that, as this news came out of Oregon earlier this week, like 2 or 3 days ago, this was breaking news. Well, breaking news for me, I would consider, coming out of Rhode Island. So the state of Rhode Island, this is how I know, yes, registered nurse positions are being cut, patient facing, but I still think there are opportunities out there for nurses. So for in the state of Rhode Island, they're now going to start allowing graduating nurses. So a nurse who's just graduated from their nursing program, but have not yet passed the NCLEX, which is like your state nurse license exam, to go ahead and start working and start practicing nursing even without a license. Now, this is interesting because typically in most states, as even though you have a bachelor's degree, associate's degree, a diploma degree in nursing, and you've graduated, until you've gotten your nursing license, you can't work as a registered nurse. Okay. It's just like, just because you know how to drive a car, if you don't have your driver's license, you're not supposed to be driving. That is breaking the law. However, Rhode Island has passed a new law that will be allowing graduated registered nurses to start practicing and working as a nurse at the bedside without their license. Now, the kicker is they have to get licensed and get their NCLEX or pass their nursing boards within 90 days. Okay. But this is telling me that, and then it goes on to talk about the benefits, how, it will help with staffing shortages. There's definitely a shortage of registered nurses in a sense, no matter in different specialties. So this will fill that gap. So you have a nurse who has the education, but they have not yet passed their boards. So I think that, no, it's not a trend. I'm not saying it's an emerging trend with these telehealth nurse positions being cut. However, I do think this is a very clear sign in the changes in opportunities for nurses. Okay. So remaining upskill, doing what you can to educate yourselves. I say often on this channel that technology is innovating healthcare and changing healthcare so rapidly that technology literally becomes obsolete as soon as it hits the market, and oftentimes within less than a year. So nurses always have to be prepared. Now, some other questions that I had about this story out of Oregon, I wonder, yes, they fired these telehealth nurses, but I wonder if those registered nurses had an opportunity to work elsewhere within the organization. I did search, I looked to see, okay, yes, they cut as much as the nursing shortage as it is. I would be curious if this organization would just cut those positions without seeing if those nurses could be assigned elsewhere. Again, considering the nurses shortage. And another thing, with this telehealth nursing, frontline nursing, these 16 nursing positions being cut, them providing care for COVID and doing triage, etc. I have seen that at other organizations where, they have these drive-through COVID test centers and etc. Once COVID kind of died down in 2023, late 2022, I did see a trend of those closing down. So very interested. You all have any comments, please leave a comment, like and share the video. I always appreciate everyone who supports this channel. And liking and sharing the video encourages me to continue creating content that you all find interesting, engaging, and helpful. And I will see you in the next video. Take care of yourself.